We get to announce another award, and that award is our Pioneer Award, and it goes to an individual who's had the courage and determination to create a new path. And like today, all of our awards have been adjacent to other announcements we've been making, and this individual is someone who passionately pursued and opened the first opioid treatment program in North Dakota. Individuals now have the ability to get effective treatment options that were not available within the state prior to 1 year ago. He faced barriers head-on, worked to gain the trust and respect of local officials and the regulators and the community at large.
This individual started working in the addiction treatment field in 2012 when he joined Community Medical Services in Phoenix, Arizona, and became the agency's CEO later that year. I visited Community Medical Services in Phoenix earlier this year. He has become a passionate advocate for providing the most effective treatment to those affected by the opioid epidemic, following numerous deaths of relatives and friends. Community Medical Services currently has 12 treatment programs throughout the states of Arizona, Alaska, Montana, and North Dakota. So please, yay. I just want to say one quick thing. North Dakota was the 49th state to open opioid treatment centers. And we've come a long way since then with this award winner. And now that we have actually, 3 locations in North Dakota, so that's awesome. But please help us congratulate our Pioneer Award winner, Nick Stavros.
Thank you. Okay, so I have 15 minutes, right? No? 3? Okay, so I'll try to fit it into 3 minutes. So I'm incredibly humbled to be literally getting an award for just being really stubborn, because I think that helped get me through the process that we went through. But I'm going to just talk a tiny bit about medication-assisted treatments. There's 2.4 million Americans diagnosed with opioid use disorder, and only about 20% of them are getting medication-assisted treatment, even though SAMHSA, the World Health Organization, the CDC, all of the global and federal agencies say that abstinence-based treatment works for about 8% of people suffering from opioid use disorder. And so we've kind of found ourselves as an agency on the front lines combating the opioid epidemic, and the state of North Dakota was about 3 or 4 years ago one of 2 states in the country that did not have opioid treatment programs. And so an opioid treatment program, what that basically means is they have the ability to utilize methadone for the treatment of addiction. It's the only type of agency that can utilize methadone for the treatment of addiction. So we utilize methadone, Suboxone, Vivitrol medications in conjunction with psychosocial counseling to treat opioid use disorder. And so I'm very, very proud that I could play a small part in making a difference in North Dakota, because we have the opportunity to work in 4 other states. We're based out of Arizona, and we see what different states are doing throughout the country to deal with the opioid epidemic. And we see a lot of headlines and newspaper articles and a lot of bullet points that a lot of times are more smoke and mirrors than they are substantial initiatives that are really going to affect positive change. But what we see in North Dakota, and I'm not just saying this because I'm getting an award today here, but what we see here and what we've seen here for the last couple of years is such a cohesive group of people that are really focused on nothing more than finding a solution. And you see a lot of, in other states, you see a lot of time being wasted debating about the best modalities of treatment or whatever. But here, where you guys have, what's happening with naloxone today, you have syringe access programs, you have OTPs, you have so much going on. And to hear a governor and a first lady talk like your governor and first lady talk about this epidemic is amazing. I wish every governor and first lady talked like that, because it is so, the changes that you're seeing in this state are coming from the top. And so I'm incredibly humbled to be receiving this award. I want to thank our North Dakota staff, Mark Schaefer, our regional director, and Wendy, our medical provider. I want to thank Kurt Snyder from Heartview and his team for also, pioneering this path. And I want to thank Pam Sagnas and Lucretia Graham from the Division of Behavioral Health. And I really believe that, a positive ROI of an initiative should be politically agnostic. We're trying to find solutions, but you don't see that a lot of times. And so please don't take it for granted how great things are actually coming along in this state, even though it always feels like we're not doing enough or we could be doing more. This entire state, everybody in this room and the leadership in this state is doing so much to affect change in this state, and I really think that you guys will be trailblazers and examples that other states can look to in the future. So I appreciate this award. Thanks.